then I'm going to come behind him. I'm going to clasp my fingers, and I'm going to rest them on his head, and I'm going to ask him about his symptoms. If he tells me he has a localized neck pain, then I'm going to take my hands and I'm going to gently traction him. If that also reproduces the same localized neck pain, especially in history of trauma, I am going to want to get a collar, and I'm going to stabilize him in slight flexion in a collar, and I want imaging to rule out a rim lesion. Okay? If their same pain is reproduced with flexion, with compression and traction, they are contraindicated for manual therapy. If when I do compression, it gives them localized neck pain, and then when I do traction, it relieves their neck pain, now I'm thinking more of the subchondral bone of the facet, which would be painful, also localized neck pain with side bending and extension. If compression reproduces their arm symptoms down their left arm, then I am going to have to figure out, is this a nerve root that is inflamed, that is getting tugged over an existing disc bulge or osteophyte, or is it because of lateral stenosis or a narrowing of the foramen? In order to tease that out, I'm going to have him go into the flexion quadrant, which is the opposite, and if that reproduces his arm symptoms, then I'm believing this is a nerve root that has been inflamed, and now it's sensitive to traction. Okay? If that happens, I don't need to do compression. Okay? If that does not, however, reproduce his neck pain, then he's going to go into what a lot of us know as the Sperling's test. If this reproduces his arm symptoms, now I'm thinking it's the foramen that is too narrow, is getting closed down on that nerve root, and if it goes down, I don't have to do compression. If it doesn't, then I add compression to see if that reproduces it. Okay? If I do traction and he says that relieves my arm pain, then I can do traction and flexion and extension. Whichever one he has pain relief in will help guide my treatment. Okay?